Namaste, Swagatam, Namaskaram. It's a great pleasure to be with all of you and have this opportunity to share my experiences, my thoughts on this wonderful occasion where we are celebrating the 96th Foundation Day of Kaivalya Dhamma. Kaivalya Dhamma for me is a second home in the field of yoga. And whenever I have been at Kaivalya Dhamma, it has been a very good night's sleep because I feel at home so much. So first of all, I would like to thank the whole Kaivalya Dhamma family, especially Swamiji, Tiwari ji, and my dear Subodh ji, for this wonderful opportunity to share with all of you. I first came to Kaivalya Dhamma as a young boy at the age of 15, and for the last 33 years have had an unbroken relationship with Kaivalya Dhamma. This morning, the topic I'm going to be sharing is a topic where I'm discussing something which I am doing each and every day of my life, and that is the integration of yoga therapy within the modern medical system. This was a dream of my father, Swami Geethananda Giri Guru Maharaj, and I have been empowered by my beloved mother, Ammaji Meenakshi Devi Bhavanani, to take this forward and share my love for yoga, my life of yoga with the medical community. Being a medical doctor, I believe I become a human bridge where I can bridge on one side the yoga community, on another side the modern medical community. Hence, the human bridge in me is enjoying sharing this talk with all of you this morning. Before I begin the official talk, I will invoke the Guru Parampara. Om Tad Paramparaye Vidmahe Jnanalingeshwaraya Dhimahi Tanno Guru Prachodayate Om Om Yoga Maharshi Dr. Swami Geethananda Giri Guru Maharaj Ki Jai. So continuing into our talk today, I am representing along with my own Guru Parampara, the CITER, Center for Yoga Therapy Education and Research at the Sri Balaji Vidyapeeth, a deemed to be university accredited with A grade by NAC and ranked in the top 100 universities of India for the past 4 years. When we talk about this coming together of yoga and modern medicine, we can see that during the last few decades, there has been a journey from CAM, Complementary and Alternative Medicine, to TCI medicine, which is traditional, complementary, and integrative medicine. So the alternative, which means you or me, complementary, which means you and I will work together, and integrative, which means us as a team. Where does yoga fit into this? Well, we have to ask the question, because if we take yoga as given to us by the great Maharishis, thousands of years of tradition, the modern medical community often has great skepticism and is reluctant to accept it at face value. Hence, it is important to find that bridge, that human bridge, where we find the young people who can bring together the yoga and the modern medicine, living bridges who live yoga but also have the modern medical knowledge. In recent times, the International Association of Yoga Therapists has grown from strength to strength, and a peer-reviewed International Journal of Yoga Therapy is existing, taking the concepts of yoga worldwide. At the same time, numerous textbooks, amazing books have come out in the field of yoga therapy, including the most recent one by Lee Majeski and myself on yoga therapy, a whole person approach to health, where we are taking forward the concept that we need not think of yoga as being prescriptive, but that it is to be taken for the individual. It is the individual who's receiving the yoga, not the diagnosis. If you look at PubMed, the gold standard for research, you will find that the term yoga therapy has 5,743 results coming up just like that. That is the amount of research output in the last few decades. And this we have taken advantage at SBV, where since 2010, we have cited in a medical institution. Unlike many universities who have it as part of physical education or sports or someplace like that, we actually have it in a medical institution where more than 75,000 participants, yes, you heard me right, 75,000 participants have received the quality of life enhancing benefits. We are also educating future yoga therapists through certificate, diploma, and all the way up to PhD degrees, where people are working towards that goal of a PhD in yoga therapy. We have been creating awareness amongst the medical, dental, nursing, and allied health students and professionals, scientifically researching the hows and whys of yoga and yoga therapy. And 115 publications have come up, 10 CMEs, and International Day of Yoga celebrations since 2015. We have a team led by our Bhishma Pitama, Professor Madan Mohanji, and now though he is retired from the forefront, we are continuing this work, taking it forward for the sake of the integration of yoga and modern medicine. Our focus is salitogenesis. Now, most people are focused on pathogenesis. That is the focus on disease. What is your diagnosis? What is your prognosis? But no one is thinking about health. And even in the healthcare system, people are more interested in the disease than the person. And this is why we are moving from pathogenesis, a focus on disease, towards salitogenesis, a focus on health. And this is an innovative path that we have been taking. This is based on Antonovsky's concept, which is a concept that goes all the way back to Shushruta and other acharyas in the field of Indian systems of medicine, that the stressor that comes in, that stressor gives us an opportunity either to become a better version of ourselves, a more healthy version, or a more sick and ill, deficient version of ourselves. The stressor gives us an opportunity to work towards either positive health, H+, that is salutogenic movement, or the pathogenic movement, which is breakdown, disease, mortality, morbidity on the H- axis. We must remember that yoga is an experiential science, a dynamic state of health. And that dynamic state of health is only a byproduct of yoga. It is not the goal of yoga. It is a byproduct. The goal of yoga, many people get very confused. And Maharishi Patanjali tells us so beautifully, Yoganga Anustanat Ashuddhikshaye Jnana Deepti Aviveka Kyatehe. The whole goal is towards that Ashuddhikshaye Jnana Deepti and Aviveka Kyate. And the byproduct is health and other stuff that comes along with it. The father of neurosurgery in India, Dr. B. Ramamurthy, has described how yoga reorients the whole functional hierarchy of the entire nervous system. And that is why it is effective in preventing and combating the modern pandemic of stress-borne disorders. One thing that is sure from our scientific evidence, that yoga has promotive, preventive, and curative potential. It is a safe, non-pharmacological therapy, and it is for sure an effective lifestyle adjuvant to reduce drug dosage and improve the quality of life in people who are especially having lifestyle disorders, the non-communicable disorders. We can prevent and manage the psychosomatic stress-related disorders like diabetes, hypertension, asthma, epilepsy, back pain, reduce or eliminate the drug dosage and dependence in these conditions. But the caveat we need to keep in mind is the yoga therapist must work in tandem with medical doctors. When managing patients on medical treatment, we cannot replace the medical doctor. A yoga therapist doesn't replace a medical doctor unless they're also trained in that field. Because the medical doctor has their field of knowledge, their scope of practice. We, as a yoga therapist, have our knowledge base and our scope of practice. So here the key word, collaboration, coming together, collaborating with each other. And I would like to remind you that Plato, 2000 years ago, has told us so beautifully, the treatment of the part shouldn't be attempted without the treatment of the entirety. And the treatment of the body without treating the mind and soul is a useless waste of time. Well, I think it still holds true 2000 years later. Where does yoga come in? Lifestyle modifications. As Dean Ornish, who has shown that a yoga-based lifestyle can reverse coronary disease, coronary artery disease, heart disease. He says yoga is a system of perfect tools for achieving union as well as healing. And my own father, Swami Geetananda Giri, when he had his accident at the age of 77, he came back with renewed vigor and became such an amazing force in his later years. And he said, modern medicine kept me alive, but yoga gave me back my life. This is the goal of yoga in rehabilitation. Coping skills, my yoga uncle B.K. Sayangarji says, yoga may not be able to cure everything, but it can surely help us endure that which it cannot cure. The healthy diet of yoga, relaxation, the cost cutting, the cost effective, cost lowering aspects of yoga would really help a lot of hospitals. Again, aging, anti-aging, anti-degeneration. It is the kaya kalpa, it is the regeneration aspects. Psychotherapy, the mind and beyond, women's health, and in research. So many places where yoga can definitely play a very important role in coming together with modern medicine. Yoga therapy works at the body, the mind, and the spirit. It creates healing, reduces suffering, restores function. And I think one of the most important aspects, especially in this pandemic time, is it creates community, even though we are online and not in person. And during this pandemic, what I have found is the community that is created in the yoga circles is a community that supports health and wellness. All of this can be explained in the medical terms. Because when I try to communicate with my medical friends and I try to tell them how yoga will help, I have to give them some scientific know-how. And psychoneuroimmunology is the key word that we always bring in. How the mind, the emotions, and the psyche affect our nervous system, the endocrine system, and our immune system. And the positive influence of yoga in these three systems is the key. Because every disease you can think of today is either caused, aggravated, worsened, or precipitated by the omnipresent stress. How do you deal with stress? Well, you tackle right up here. How do you perceive stress? And when you change your perception of the stressor, when you change the way you perceive the stress, suddenly, instead of the stress response, you go on to the relaxation response. And this is a very key aspect. When you look at the way the stress comes down into your system, the hypothalamo-pituitary adrenal axis and the sympathetic nervous system, in this whole cascade, so many parts of this cascade are there. And yet, at each of these points, you will find an asterisk there, a star. That is where research shows us that yoga can help. Yoga is an excellent vaccine before stress comes in. And if stress has come in, it is a very good antidote. So the vaccine and the antidote to stress, well, both are yoga. And work has been done by Streeter and colleagues showing how the underactivity of the GABA, the allostatic load, which is your body trying to maintain normalcy, how that load can come down, even with a single session and then over multiple sessions of yoga. Documented evidence of this concept. This is why the relaxation and the stress, we move from the stress response that retards rehabilitation and delays healing. We move from that by the power of choice, which is the superpower of being human. We can move to switch on our relaxation response through the parasympathetic nervous system. And this helps rehabilitation and manifests healing from within. It doesn't matter whether you're using allopathy, homeopathy, osteopathy, chiropathy. It doesn't matter what you do. As long as you want to manifest healing, yoga as part of that integrative, collaborative team will enhance that healing irrespective of what type of therapy you're using. So yoga can fit into all management protocols. That is what we like to tell our colleagues. And what is the greatest contribution of yoga to modern healthcare? Relaxation. Because as a modern medical doctor, I am not given any tools to help the person relax, except some of the medicines we give them, some of the drugs. And as long as you are giving a drug to relax somebody, you are just going to get them addicted on that, nothing else. But when you can give them the yoga practices, amazing practices that can educe from within the relaxation response, the more you relax yourself, the better your healing will be. And that is the message we always give. Doesn't matter whether it is coronary artery disease, hypertension, diabetes, back pain, recovery from a surgery, or someone going in for a surgery. They have so much of stress. Well, can you reduce that? Yes, we have shown you can. And my dear Sadhbir Khalsa and his team, they have given this beautiful concept, how the yoga practices are working on 4 domains: fitness, self-regulation, awareness, and spirituality, thus enhancing the global human functionality. And I often use this slide to get the message across to my medical colleagues, because it speaks the language they will understand. And if you don't speak that language, you will always be an outlier. You will never become part of the inside team. This is the lesson. Similarly, we need to talk about mechanisms. How can yoga help? There are beautiful mechanisms given by people like Ines. And again, these type of pathways, when you talk about these pathways to the medical scientists, one pathway being the reduction of perceived stress, decreased activation, reactivity of the sympathoadrenal and hypothalamo-pituitary adrenal axis. The other pathway, vagal stimulation, parasympathetic tone, showing changes in heart rate variability, baroreflex sensitivity, decreased inflammatory cytokines, and reduction in heart rate and blood pressure. You enhance the metabolic and psychological profile. These are the terms you need to use when you want to be on the inside. And over the past 10 years at CITER, and for many years before that, from the year around 2000, I have been working in different medical institutions, including JIPMER. And you need to understand that yoga is not something yes. So just get back onto my PowerPoint. Give me 1 second. Sorry for that technical disruption. I'll just go on from there. We need to speak the language of the modern medical scientists, because if you don't speak their language, it's not going to have an impact on them. You will not create that bridge. So to create that bridge, research that has been done, these performance improvement, when you can show it, when you can show the mechanisms by which yoga will help those who have dyspnea, difficulty in breathing, when you talk about the postulated mechanisms for the role of yoga in pregnancy outcomes, and when you talk about how yoga, it's not about curing the cancer, but helping the person have a much better life. It is so important that we have that much better life. How do you have that much better life? You reduce the fatigue. You enhance the pain tolerance. You give them a sense of life is meaningful. That is such an important aspect to bring into all of this. Similarly, yoga in chronic low back pain, mechanisms, when you bring those mechanisms, just take 1 second because somebody is playing some tricks there with the annotation part. Thank you. I request the participants not to play with the slides and annotate them. Okay. Similarly, research we have been doing over the last 10 years, showing the different pranayamas, and again, how the normalization of autonomic cardiovascular rhythms, enhanced cardiac autonomic regulation, improved baroreflex sensitivity. These are terms you need to use. These are concepts that need to be taken forward if you are going to, definitely work on how to do that. Very important aspect, because what we often find is why yoga is not becoming part of the insight team is the yoga therapist or the yoga instructors in medical institutions are not speaking the same language as the medical specialists. And if you don't communicate, well, you're not going to be part of the team. So we have made this effort, and over the last 10 years, we have seen more than 75,000 participants. The range goes from orthopedics, general medicine, dermatology, obstetrics and gynecology, psychiatry, pulmonology, neurology, you name it, and those departments have been part of our integrative work. At CITER, our participants can come to the center. They are either coming on self-referral, referral from the different medical specialties, or because somebody who they know benefited. So there's this constant referral system coming in. And you can see how the work with the special children, it is a very important aspect of our work at CITER. Work with the special children, which you can see here. Work in the psychiatry ward. We go into the ward, the psychiatry ward, and every day, the patients there who are admitted, they are given a chance to have yoga sessions. The palliative ward, where people are, admitted towards the end of life, and well, go in and support them. And it is such an important aspect there to support those in those last days of their life. Again, the work with the special children. From this photo, you will not be able to tell the difference. Who is the special child and who our yoga instructors are, unless you look at the dress. The color of the dress is what differentiated such beautiful performance. You elevate the consciousness, you elevate the whole life. And again, taking it into the OPD, taking it right into the entry level of the hospital. As people come in to register for the different departments, they get exposed to the awareness of yoga and yoga therapy. Similarly, going out into the nearby primary health centers, now they are called the wellness centers, and again giving sessions there. Going out and giving camps as part of all our medical camps, the yoga therapy becomes part of it. So it's not just a yoga center in a hospital. You are an integrated center where you become part of all the hospital activities. And often people try to give a religious tinge to this. Oh, certain communities don't want. No, this person here, he belongs to the Muslim community. And how much he benefited from the yoga therapy. He came to us and he said, Dr. Ananda, I have been referred for yoga. I've had one lung removed because of thymoma. And I said, what do you expect from yoga? He says, I want to pray to my God. I am not able to do my namas. I'm not able to do my daily prayer. And after a few sessions, he was so happy. This was the day he came and talked to me. He was so happy, catching my hand and saying, Dr. Ananda, your team is so wonderful. I am able to bend forward. I am able to do my movements of praying to my God. My life is worth living, and I'm ready. Even if I die today, I die with a sense of fulfillment. This is the type of transformation that yoga brings into people. And we are in times of COVID-19. And you can see our instructors, they are going right into the COVID wards. And those patients who are admitted with the COVID symptoms in Pondicherry, they are given the yoga practices. You can see our instructors in the full PPE kit. Very tough to even breathe, let alone do the yoga practices. And these yoga COVID warriors, Dhanush, Apnadesh, and Charulata, they are going 5 times a week into the ward, giving the yoga. And so many of the participants who are there, even after they get discharged, they phone us, they say, that was the best part of being in the hospital is the daily yoga sessions. And we are continuing to do it at home. We are practicing. And along with that, our nursing staff, all the frontline warriors of our hospital, they are getting, because they are under stress of dealing with the unknown factor. Who has COVID? Who doesn't have COVID? How to manage it? And yes, they have such levels of stress and anxiety. And we are giving them the yoga sessions to reduce the stress and anxiety. And about 40% of stress anxiety reduction was seen even in one session. This is how you take it right down into the grassroots. And you back it up by research. Research in essential hypertension, research in the psychiatry ward, research in chronic kidney disease, overnight sleep deprivation in young health professionals who are working in emergency department, patients who have chronic obstructive pulmonary disease, in mothers, pregnant mothers, antenatal mothers, how pranayama can help them, how a combination of music and yoga therapy can reduce the stress in those who are posted for an angiography. How can it enhance the performance and the life of children with autism spectrum disorder? Patients with diabetic lung, yes, lung is also affected in diabetes. The effect of Bhavanani on chronic rhinosinusitis and the snot scores. Because, sinusitis may not kill you, but it really, really irritates your whole life and takes the quality of life out of it. Adding Bhavanani to it, amazing changes in our participants. And again, children with autism, they find dental hygiene to be very difficult, and how that can be enhanced, how they can learn the traditional toothbrushing techniques by adding yoga to it. The learning capacity is enhanced. And of course, the omnipresent depression, how does yoga help? These 12 are just the key papers of so much of our research that we have been publishing to supplement it. And at our deemed to be university, a yoga abhyasa program is running for all the students of the university. The medical students, the dental, the nursing, the allied health, the physiotherapy, the pharmacy, all the students as part of the curriculum are being given yoga in this yoga abhyasa. And an amazing program going on thanks to the management and administrators of our university. You can see the yoga, the stretch being taken right into the classroom. And they can also come to Saita for centers. We go into their classroom to give them that yoga feel. And the medical professionals, the professors, the teaching team, they are given it in the CMEs, so that each and every member of our family, the nursing team coming to Saita and enjoying the Brahmari practice. This is how you bring it. It has to be at the student level. It has to be at the residents. It has to be at the junior faculty, the senior faculty, the patients, the administrators, the general public, the community outreach. All of this, when it comes together, what happens is that yoga, when it is integrated as a therapy in a medical institution, you start to have these very positive impacts. And we have been supported by leaders talking about how this is a path-breaking innovation and how this is the most needed aspect of the hour, and how we are balancing the difficult path of staying true to tradition and adapting it to the modern world. And even Yogacharya Kalavati in the UK has given us a beautiful feedback. It is such an inspiration. There should be more such projects. And so many have felt they should have such projects back home in their own countries. Wonderful work from, so many people being applauded by so many luminaries, including Shirley Tellis, Sridharan Sir, our Joseph Lee Page, and Natalie, a midwife who was one of our alumni, where she talks about it as a great opportunity to train hands-on in the application of yoga in medicine, excellent training in a yoga therapy department within a modern medical hospital with a unique team. This is the type of integration that is happening, an integration that is based on building human connection, the humanistic aspect of medicine being reiterated by integrating yoga in a medical institution. And support from the press with amazing support from all sides. And you can see the MOU that Kaivalyadama and Saiter have, Amiti and Saiter have, and how we are constantly having this beautiful support from the public, the press. I think that support really gives us the energy, gives us the support in our heart that we say, yes, this can be done, and we take it forward. And I think I will end my presentation with the aspect that I always bring into it, and that is gratitude is the highest attitude. When we are grateful for all the good fortune we have, we become a better version of ourselves. When we are a better version of ourselves, we can represent our ancestors, the tradition. In my case, the Gitananda Yoga tradition given to us by Swami Kanakananda Brigu on one side, Kabli Swamigal on the other side, brought down through my father, Swami Gitananda Giri, and my illustrious mother, Ammaji Meenakshi Devi Bhavanani, the living Siddha of Pondicherry. Taking the message forward in such a way that we realize yoga and modern medicine, they can come together. They come together very effectively at Sri Balaji Vidyapeeth, where the Center for Yoga Therapy, Education and Research is showing that it can be done, how it can be done, and becoming a role model that others can implement all over the world. Remember, you need to communicate. You need to speak the language. When you start to speak the language of the medical scientist, when you start communicating with them, and ultimately, I think the proof lies in the taste. So you show that you can do it. You show that it can be done. And when the patients come back and tell the doctors, I feel so much better. This has really worked for me. And when the students come and say, by doing this, I feel so much better. I have seen the changes in the patients. I have seen the changes in the caregivers. I have seen the changes in society. This is where yoga comes alive in society, because yoga is to be transformative. It is transformative at the personal level. It is transformative at the society level. And it is transformative at each and every level of our very being. Yoga is transformation. Let us be that transformation that we want to see in society. Let us be the change we want to see in the world, as said by the great Mahatma. That is my message for you today, celebrating the 96th Foundation Day of Kaivalyadama, and wishing Kaivalyadama great success as it goes towards the centenary year. And let us have a wonderful wish for the birthday of Kaivalyadama, and in a few years, be there for that 100th year celebration too. Those of you who wish to have my slides, they will be uploaded on my SlideShare. You just go SlideShare, Bhavanani. Within another 15-20 minutes, it will be there on SlideShare, because I believe in sharing is caring. And you'll find more than 500 SlideShares there for free download. And the more we share, the more we care, the more we care, the more we share. And through that, we support each other. So with those words, I thank Kaivaladama for this opportunity to be with all of you. And let's all have a wonderful day as we continue to grow and glow in yoga together. Hari Om Tat Sat.
Thank you so much, Dr. Bhavanani. That presentation was actually transformative, and I am very sure all our audiences have actually agreed and taken inspiration from your hands-on experiences. The pictures that you showed, the intervention currently is definitely the need of the time, where we should apply yoga therapy as a part of one of the therapies with all the medical institutions. And I also hope that all the medical institution and yoga therapists and yoga institution take inspiration from your talk today and do the collaboration, which is definitely I truly believe is also need of the hour. So I'm going to give my gratitude on behalf of Kevaladham Yoga Institute for giving us such an inspirational presentation and giving us your time, coming us here online with us. Thank you so much, Dr. Bhavanani.
Thank you so much. Namaste.